afternoon, everybody. Thank you so much for joining the webinar. Welcome to the first webinar in our emergency shelter learning series, the critical role of emergency shelter in a crisis response system. My name is Anna Blasco, and I work for the Alliance's Center for Capacity Building. We have over 1,000 people signed up for today's webinar, which is very exciting, but we're aware that it might be causing a little bit of audio issues. So if you hear us breaking up a little bit, we apologize. We're working on it, but we're aware that the audio may not be perfect, so we apologize. So before we get started, quick housekeeping notes. We've muted everyone on the webinar, but we do want to hear from you. So please ask a question at any time by typing it into the questions box. I'll go ahead and answer one question you might already have, which is, yes, this webinar is being recorded and will be posted on our website, www.endhomelessness.org. We will post it as soon as possible once the webinar is over. We hope that you'll share it with your colleagues and any other stakeholders. You'll also see that there are 5 documents you can download in the handout section of the sidebar of your webinar. These are self-assessments and action planning tools. We hope you'll take them back and use them after this webinar. We'll tell you a little bit more about them in a moment, but we will also send out a link into the chat in a little bit where you can also access those online. Okay, so one more thing. Did you know that today is National Call-In Day to End Homelessness? Congress is facing a deadline of Friday, April 28th, to fund the federal government for the remainder of fiscal year 2017. So we need you to tell them how important federal funding is to ending homelessness in your community. You can call using our online system, and the URL is up on your screen right now. I'll also send that out in the chat in just a moment. We've made it really easy, so it should only take you a couple minutes to call your representative and let them know they need to fund homelessness assistance programs. Okay, so now I'd like to introduce Cynthia Nagendra, who's going to take it from here. I'm going to give you the control of the screen. All right, so you should be able to share your screen now.
Hello, everybody. Does that look okay? Hello?
Yep, you're all set.
Okay, just checking you're on mute. Okay, just let me know. So yeah, thanks, Anna, so much for introducing this webinar. And again, if people have trouble hearing us, just please put something in the chat box and let us know if it starts to break up, and we will try to fix that. So as Anna said, we're really excited that you're all here. My name is Cynthia Nagendra, and I'm the director of the Alliance's Center for Capacity Building. I'm joined today by my wonderful colleague, Kay Mosier-McDivitt, and we are really excited to launch this emergency shelter learning series, and really thrilled that so many people are attending, and we hope that that means that you know, that this is really a topic that a lot of people have wanted to talk about, and we know that there's a lot of discussions going on in just about every community on this topic, and we hope that over the coming months you really get what you came for. Before we begin, I want to take a minute to acknowledge that operating an emergency shelter is really just one of the most difficult jobs there is, and we are grateful for the often life-saving work that you do in your communities. This series is really meant to help communities and shelters build on the important work that shelters already do to respond to homelessness and really shift in ways that will benefit people experiencing homelessness as well as people working in homelessness. And in this series, we will probably several times also acknowledge that change is really hard. People really don't like change, and doing things differently can be really anxiety-provoking. We really get that. We are working with many shelters right now experiencing this transition, and we're watching them kind of go through the different stages of that. But you know, despite all that, we also hope you will hear about strategies and experiences from other shelters to make your work easier, more rewarding, and ultimately improve outcomes for people experiencing homelessness in your communities. And we hope to get you fired up and to make the changes you want to make. Just a little bit about us. I'm sure most of you know, but I just want to talk a little bit about the National Alliance to End Homelessness. We work in these primary areas: research, policy and advocacy, and capacity building. The Center for Capacity Building works directly in communities to identify and evaluate policy and program strategies, promising and best practices to really help communities replicate and customize the best of those strategies that can effectively reduce homelessness. The shelter series is intended for various stakeholders, including emergency shelter leadership and frontline staff, public and private funders, COC and system leadership, and technical assistance providers and other partners in the field. We know there's folks working on homelessness that come from all different areas, and we hope that, that this is sort of useful for various audiences. These webinars will be recorded and posted. I will later give you the landing page that we're going to be posting all of our webinars and all of our resources. So please feel free to send it to other people you know who couldn't make it or might be interested in your community. So the primary goals of this emergency shelter learning series are to help communities really strengthen shelter policies and services to improve the housing outcomes for people experiencing homelessness across your entire crisis response system. It's also to help implement a system-wide approach to ending homelessness that includes emergency shelters. We know that often emergency shelters have not necessarily been included in these larger systems change conversations that have been going on in communities for the last few years, and we really want to help you figure out how to come up with a system-wide approach that includes emergency shelters because they are so vital to your crisis response system. Also, we want to help you align emergency shelters' goals with the community's goals to end homelessness. Oftentimes they're the same, but sometimes shelters are looking at different things than the community might be looking at. And it's really important if you want to have an effective crisis response system to align the goals of the interventions with the larger community goals to end homelessness. And finally, we want to help communities provide low-barrier, safe, and housing-focused shelter. We'll spend a lot of time over the next few months talking about how to do that. So over the next 6 months, or as long as you decide to participate in this learning series, we want to not just provide information, but we also really want to guide shelters to action and accomplish the following activities during the course of the series so that you may build on the work that you're already doing to solve homelessness by aligning your shelters with these recommended practices. It looks like a lot, and I know that it can be a little bit overwhelming, but over the coming months we hope that we help you break it down. We've seen a lot of communities now kind of making these changes in a relatively short amount of time. We'll hear from those communities in the coming months, and we really think that sort of helping you figure out how to break down and action plan what you want to do will be helpful. So over the coming months, you'll be guided to understand the role of shelter in a crisis response system. We'll talk a lot about that today. We'll also help you assess how your shelter currently aligns with the key elements to effective emergency shelter. We'll help you figure out how to implement the key elements to effective emergency shelter. We also want to help you develop goals, action plans, and a timeline to make the shift to a low-barrier housing-focused shelter model if that's not where you already are. I think you all know that developing goals and having a timeline really helps to make sure that implementation really happens. We'll also talk a lot about data, so we'll be helping you track your shelter metrics, which we will release some tools around, and help you establish benchmarks to improve outcomes over the next few months. So during this series, we want to provide a variety of tools to help you implement these changes in your community. We're going to be doing a series of webinars, probably about one a month over the next 6 months. We will also we have an infographic that will be downloadable from our website that are the key elements to operating an effective shelter. We'll spend a lot of time talking about those key elements over the next few months. We also have self-assessments to assess your shelter. You'll see that you'll be able to download actually in the handout section of this webinar. If you sort of see a tab on your screen that says handouts, there are 5 self-assessments that you can download that include action plans. There's also an online version of the survey, and I will give you the link to that at the very end of this. So we really hope that you start doing those self-assessments. They don't take a long time to kind of get a sense for where you are. It'll help sort of set the stage for the next few months. We're also going to provide tools that your shelter can use to implement programmatic policy and operational changes, as well as guidance from shelters that have actually made this transition to a new shelter model. I find that it's really powerful to hear from shelter providers who went from a very different shelter model to really transitioning to this newer model that we're talking about today, and what that was like and what it's like on the other side. So throughout this webinar series, we'll also be asking you where you find yourself on the scale of transformational change. Many of you might be on the left side of the scale, starting to recognize a need to change because what you're doing isn't working as well as you want, and it might be because you have limited resources or limited staff, or you're just quite not sure really what the best practices are. And it is likely that you will go through these various stages of change as you work through this process of transforming your shelter. A lot of people feel confusion sort of about where they're headed, a real sense of anxiety and a sense of loss, because you're really changing the way you have worked for so long, and that can be very anxiety-provoking. And eventually you will be arriving at clarity, hopefully, to develop a new vision and integrate into a new shelter model. And it might not take as long as you think. So in today's webinar, we're going to focus on the critical role of emergency shelter in the crisis response system. We will discuss the following questions. We are going to talk about what is known about shelter stays, what the role of emergency shelter is in a crisis response system that aims to end homelessness, how should communities connect to shelters and connect shelters to the crisis in a system in a meaningful way. How should communities align the goals of shelter with system performance outcomes? And we'll touch briefly on the keys to operating an effective shelter and do a much deeper dive in the next webinar on that. So I want to just tell you a little bit about the Alliance's work and kind of how we arrived here. For the past couple of years, we have made a focused effort to learn as much as we could from the field about what effective shelter practices really look like on the ground, how they impact homelessness communities, how they work in different geographies. So we looked at national data and research, what we already kind of know about shelter stays and utilization. And we interviewed shelters across the country in different geographies, serving different populations. We looked at things like housing outcomes, length of stay, staffing, rules, eligibility, level of integration into the rest of the crisis response system, how people work with coordinated entry. And we started to see some common key elements to effective shelters that had really good housing outcomes for their clients in an environment where they were seeing an impact in their numbers in reducing homelessness. And so that's kind of where the 5 keys to effective shelters really originated. And so we've been working in various communities to implement the 5 keys. We've been working in large and small communities to guide their shelters transition from high barrier shelters to a more low barrier housing focused model that is better integrated into their systems response to homelessness. We've learned a lot through these engagements and continue to learn, so we really welcome your feedback as you go through this process on what works, what doesn't work, and really what innovations you are trying that can be shared with other communities, because we know that you're the experts, you're the ones who have a lot of ideas about how to innovate, and we really want to learn more from you, so we really, really welcome your knowledge.
Okay, so it's time for our first poll question, which you guys should be seeing now. And we want to hear from you. What do you think the primary goal of emergency shelter is? To provide a safe place for people to stay in a housing crisis, meet basic survival needs such as food, shelter, and clothing, connect people to resources, help people return to permanent housing, or help people stay clean and sober. Only about 13% of you have voted thus far. So if you could just take a quick second and let us know what you think the primary goal of emergency shelter is. 44%, okay, we're a little under half, so just make sure that you're putting in your votes. Okay, 64%. Okay, so we're at 74% of people filling in the poll, so I'm going to close it. And let's see, 46% of you said to provide a safe place to stay for people in a housing crisis. 35% said help people return to permanent housing. 15% said meet basic survival needs. And 4% said connect people to resources. Okay, I'll turn it back to you, Cynthia.
Thanks, Anna. And I will kick us off with what we know about shelter stays. So what do we know about shelter stays? And I actually, one thing about that poll, we will come back to that poll to get a sense of kind of where people started in thinking about their primary goals for shelter and how that might change over time. So what do we know about shelter stays? Well, from the 2015 AHAR, you can see here the national length of stay in emergency shelter. On the left, you have the median number of nights and the average number of nights, which range, median number of nights is around 27, average number of nights is about 68. The national length of stay in emergency shelter on the right is, you can see sort of it broken down. About 28% of people are staying for less than 7 days. 26% of people are staying for about 8 to 30 days. 35% of people are staying for 31 to 180 days, and then a smaller group of folks, 6%, are staying anywhere between 180 days to a year, and 5% of people are staying over a year. First, we're going to discuss some research here to determine what we know about shelter stays. This will help inform how you design your programs ultimately. This comes from a Kuhn and Culhane study from 1998, applying cluster analysis to test a typology of homelessness by pattern of shelter utilization. You can see the citation at the bottom there if you're interested in the study. What that tells us, amongst other things, is that a majority of individuals and families who become homeless have relatively short stays in the homeless system and rarely come back to it. It's important to remember that because I think oftentimes when we are working in programs, I know I had this experience when I was a case manager, I felt that people really, you felt like people were coming back a lot or that people were staying a long time, but often that's because those are the people that you see. But when you really look at your data, oftentimes you will find the majority of people really have relatively short stays and rarely come back into homelessness. So it's important for us to remember that a lot of people get out of homelessness pretty quickly with relatively little to medium assistance. So this is from Dennis Culhane's Testing a Typology of Family Homelessness based on patterns of public shelter utilization in 4 U.S. jurisdictions from 2007. And from this study, we learned that families with long stays are no more likely than families with short stays to have intensive behavioral health treatment histories, to be disabled, or to be unemployed. So what that suggests is that system decisions rather than family characteristics are responsible for long homeless stays. So things like shelter program rules or how you're moving people into different interventions are really determining how long people are homeless for the most part, rather than families having, say, very difficult barriers or difficulty getting access to housing and employment. Sometimes it's really the system decisions and the way we design our interventions that are keeping people homeless. So a good example is like shelter program rules and system design might be keeping people homeless longer. And if you think about if you had a shelter that was allowing people to stay in shelter for a year, and say in that shelter you had to follow a program that lasted a few months and you had mandatory services for months to stay in shelter, and you didn't have any assistance to get out of shelter, you'd probably stay there for a lot longer than you would if you had help as soon as you entered to get out in terms of financial assistance or other types of services, in which case you might not stay in shelter for quite as long. So we should design our system accordingly. Shelters should really help facilitate those self-resolvers. We saw that a lot of people, are really there for a short amount of time. Now, we don't know a lot about where self-resolvers go, but we do know that they don't come back into the system. So shelters sort of help facilitate those self-resolvers' ability to get housed quickly on their own and find housing options for them rather than sort of putting any barriers between them and those options. We want to assume that most people can exit shelter to housing with some assistance, and that only a minority of people will need to access a very intensive intervention like transitional housing or permanent supportive housing. It's usually a very small percentage of folks that need that. So I think oftentimes, again, we sort of have this idea that a lot of people are going to need a lot of intensive support. But the data suggests that most people can exit homeless with a light touch of services. So what do we know about shelter costs? Costs to stay in shelter, and this comes from the Family Options Study. If you'd like to look at the study, it's the short-term impacts of housing and services interventions for homeless families, done by the U.S. Department of Housing and Urban Development. The Family Options Study tells us the cost to stay in shelter is about $16,829 per stay by a family. And the majority of the money was spent on services versus the physical shelter, which is another interesting point. So shelters are spending a lot of money on services, even more so than their actual physical space. And as you can see, the cost is quite high for a shelter, especially compared to other interventions. So another thing we want to think about is, you know, when you're looking at your shelters, how long are people staying? How much is it costing per family or individual? And if we started to exit more people to housing, how can we, sort of reduce some of those costs? I mean, oftentimes these costs have a lot to do with length of stay. Quickly, I want to touch on why people avoid shelters. We'll talk a lot more about this in our next webinar when we talk about low barrier environments and why they're important, because it sort of responds to why people avoid shelters. So in November 2016, more than 1,000 surveys were completed with individuals experiencing homelessness in the city of Seattle. And the survey was been supplemented by several targeted focus groups with different subpopulations. And this was including youth, families with children, singles, those who were in encampments, those people who just were not coming into shelter. And so here what we learned is that you can see the breakdown that people are avoiding shelters for various reasons. 37% say they're too crowded, 30% say that there are bugs there, 28% there are too many rules, 27% that they're full and they can't get in. 23% said they can't stay with their partner or their family and they don't want to be separated from them, as sometimes people have to be separated by gender or for other reasons. Germs, 22%, they don't accept pets, so people often don't want to leave their pet behind just to enter shelter, and they also don't want to leave their stuff behind. Sometimes they're too far away, and sometimes people want to stay with their friends. We'll talk more about this, but I think it's kind of a good framework for us to understand, well, you know, what are we doing as shelters to sort of accommodate some of these needs? So what is the critical role of shelter in an effective crisis response system? Why are shelters so important? I'm really here to tell you that shelters are incredibly important. They are very much they're a critical part of any crisis response system, and it's being able to work effectively. Shelter is often a community's immediate response to a housing crisis. When homelessness first started becoming prevalent in communities across the country a few decades ago, shelters really became one of the main responses to manage people's housing crises. We owe a lot to the faith-based communities and shelters for really responding in the best way they knew how. And without understanding homelessness as much as we do today, meeting the basic needs of food and shelter was a way to manage the issue, and we thought that was the right way. And so after years of research and trying different interventions, we now know that housing is the solution to homelessness. But that doesn't mean we don't need shelter. Shelters, street outreach, other crisis services are still often the front line of any community's response to homelessness. And but homelessness is not truly ended for people until they obtain and maintain housing. So this requires communities to shift from a set of services that simply manages the crisis of homelessness to a crisis response system that can help prevent and resolve homelessness. And shelters very much are needed in that crisis response system. Shelters and other types of crisis beds are critical to the functioning of this effective crisis response system in any community. Why? Because people will continue to have housing crises. And will always need a safe place to stay, to go when having a housing crisis. And even if the system has achieved functional zero, or you have already ended homelessness, or you're very close to making homelessness rare, brief, and non-recurring, people are still going to have housing crises. And emergency shelters and emergency response that helps them quickly get into housing and not lets them be on the street or homeless for very long periods of time is still incredibly important. The U.S. Interagency Council on Homelessness, or USIC, describes the elements of an effective crisis response system in the following way. An effective crisis response system identifies all people experiencing homelessness or experiencing or at risk of experiencing homelessness across the community, prevents homelessness whenever possible, provides immediate access through coordinated entry to shelter and crisis services without barriers to entry as stable housing and supports are being secured. It also quickly connects people who experience homelessness to housing assistance and or services tailored to the unique strengths and needs of each household. So you can see where shelter sort of fits into the system and why it's so important. It's very much the front door to the crisis response system along with coordinated entry. So in other words, an effective crisis response system should really provide immediate and low barrier access to safe and decent shelter to anyone that needs it and aims to house people as quickly as possible. Sometimes people can get stuck outside of shelter and be living on the street or in other places not meant for human habitation, or they can get stuck in shelter with no assistance to exit. We're going to talk a little bit more about that. So the role of shelter, again, we will discuss some of this in following webinars, but I wanted to just make sure we kind of got a sense for where shelters fit into the system. Shelters should be diverting people from entering shelter if they have a safe and appropriate housing alternatives. We'll spend a lot more time on that in the next webinar. We want shelters to provide access to crisis beds, and we want that to be, available, and we want communities to have capacity to be able to do that, so nobody has to sleep on the street. Shelters really need to enable flow through your system to housing, and I'll talk a little bit more about that in the next slide. And the front door has to be connected to permanent housing solutions. So as communities try to figure out what their shelter capacity should be, whether they should build new beds or they should invest in permanent housing solutions, shelter and housing solutions should really be thought of in tandem. If you build a lot of shelter without an exit plan for the folks in that shelter, you're going to keep needing more shelter. So the front door really needs to be connected to the back door of housing. So here's a really simple depiction of a crisis response system, and it's just to sort of illustrate where shelter sits and how people should really flow through shelter. People enter the system in different ways and ideally access assistance through an established coordinated entry system that prioritizes the people experiencing homelessness who are most in need of help for shelter, housing, and housing support services that's based on their individual needs and strengths. And so as permanent housing is usually not immediately available, people need access to shelter while they are trying to access a more permanent housing solution. And people should flow through shelter as quickly as possible to a permanent housing solution. We don't want people sort of languishing in shelter for a long time because it lengthens their experience of homelessness, and we know that that has very negative impacts. It also doesn't free up beds for other people who need to get in. So because this is not often how this works in a community, because people get stuck either trying to access shelter and are able to access shelter because of lack of capacity, high barriers to get into shelter, other reasons that we saw in the survey from Seattle, or they get stuck in shelter because they aren't able to access a permanent housing exit that would help them end their homelessness and get out of shelter more quickly. So, and this comes from OrgCode's How to Be an Awesome Shelter, and I think it's a really important concept. Shelter should be a part of a process to get someone housed, not a destination. So I think oftentimes we sort of think that, and in many shelters are the only sort of main response in their community for people who are experiencing homelessness, and so they have to provide a lot. And we'll talk a lot over the next few months about how to focus your services and how to make shelter a process and not a destination that people feel like that's their only option to stay at for a long time. So in other words, a good rule for how to think about the role of shelters is that people have to be able to get in and people have to be able to get out to housing. And with that, I'm going to hand it over to Kay. Kay, if you want to unmute yourself, I can take care of your slides.
Great. Thanks, Cynthia. If you want to go to the next slide. So again, we're really excited, and I want to welcome you as well, Cynthia did. And so now Cynthia set this basic framework for the important role that shelter plays in a crisis response system. And I think one of the things that Cynthia and I often talk about, or the whole capacity building team when we're out doing training on emergency shelter, is that this is about, like looking at all the good work that you've done, that you're currently doing, and how what can we do to make our work even better. And so now that we've set the framework, like how do we align the goals of shelter with our community's goal to prevent and end homelessness? Because we have our own goals, but we now need to make sure instead of having our own individual goals, how do we think about them as system goals? So if you remember, Cynthia talked about that a critical aspect of communities that are just decreasing homelessness is that they are focusing on a systemic response to looking at how everything works together instead of looking at a bunch of individual programs that operate independently as a community. So how are we part of the system? How do we think of our role as part of the system? And then how do we align the goals of the shelter with the community's goals to prevent and end homelessness? So next slide. So again, just can't reiterate enough about the really important role that shelters play in your community's response to homelessness, because what happens in shelter greatly impacts your system's performance in decreasing homelessness. So what happens at the shelter, including what you see in the slide, the average length of stay, the exit from permanent housing, and the returns to how homelessness are going to impact your community's overall systemic performance. So for example, if people are spending long periods of time in the shelter and then they're largely exiting back into homelessness, that's going to in fact affect your community's overarching outcomes, your systemic outcomes. And you probably know this, but your community now is starting to have to report systemic outcomes of like what's happening across the system. So we also know that sometimes shelters will time people out and then they're bouncing from shelter to shelter. So 30 days in one shelter, 60 days in another shelter, 30 days in another shelter. That's all adding up. So that's not a 30-day stay. That's, quickly in my head, I'm going, okay, what did I do 4 months here? So that's like a 120-day stay because the clock starts ticking the minute they're identified as homeless at any shelter door. So really, it's really important to think about your role and what happens in the shelter and how it's impacts the overall ability to have an effective crisis response system that makes homelessness, and again, using that term, rare, brief, and non-recurring. So in the webinar series, we're really going to talk about a lot more about how shelters can measure these outcomes, so keep your eyes open for that. But as I already mentioned, communities that are decreasing homelessness are really critically focused on their local homeless response system as a coordinated system of homeless assistance options. So it's a lot different. I think, we look at our own outcomes and we think about, okay, well, this is what we're doing just individually as a shelter. Now it's important to think about how does that contribute to the larger thing. And I already said this, but communities are being required, just to make sure you know how important this is, the communities are required to measure their performance as part of the coordinated system. So in addition to looking at specific projects or project types, the HEART Act has established system-level performance measures for HUD. And this is really about what your awards are, so it impacts the funding that comes into your community. And so, for example, in continuum care funding, we know that shelters don't get continuum care funding due emergency shelter. But you need all of those other services. You need the rapid housing services, the permanent supportive housing, coordinated entry. Those other things that make your system work are critically important. So how well you do in impacting those shelter outcomes can really make an impact on your funding that comes in and your scoring on your continuum care. So it's really also important to know that there's coordination with ESG program recipients and all other homeless service providers to regularly measure their progress in meeting these needs for people experiencing homelessness in the community, and getting that report of progress back to HUD is just critical. So I like to say that think of your coordinated entry or your whole coordinated system as like one clock. So including coordinated entry and emergency shelters and rapid housing and targeted transitional housing and permanent supportive housing. You're not a lot of individual clocks working together around the table. You're one clock, and each of you individually and each intervention represents a gear in that clock. And like we know, right, what happens to a clock? If one gear gets out of whack or stops working, it's going to affect the entire clock. The clock will not work correctly. So really thinking of your role and the emergency shelter's role as a really critical gear in that clock that has to be well-oiled and working really well. So the next slide, please. So I think we know shelters are often used to reporting outputs. A lot of times, our funding sources have asked for things like, well, what are your total number of beds that are filled? What's the number of nights of shelter you provide each month? The number of meals served, the number of case management hours or contacts, the number of meetings held, the number of services provided. But the impact on shelter and reducing homelessness and the role that you play in the crisis response system is really reflected by outcomes, not outputs. So these metrics, what you see on this slide, focus on the outcomes. When you start to focus on results that end homelessness, your results are going to get better. And even more important, as you start focusing on these things, you're going to see the impact you have on reducing homelessness in your community. So it's really, so thinking about this role, and again, remember, we're going to talk a lot more about this later when we talk about the role of data, but we want you to start thinking about this and start thinking about, well, what do we currently measure? And you want to start measuring outcomes that are going to really show whether you're effective in preventing and homelessness. So you should measure, again, on here, you want to look at the average length of stay, the length of time folks are homeless in your shelter, the access to permanent housing. So we want to decrease the length of stay. We want length of stay in homelessness to go lower. We want to, at the same time, increase access to permanent housing, and then we also want to decrease returns to shelter and homelessness. So the next slide. What's really, really important is that you don't arbitrarily shorten the length of stay in shelter without considering access to permanent housing. All of those outcomes that I just showed you are all interconnected. You need to evaluate them together. So for example, if the length of shelter stay is 30 days because the shelter only allows people to stay for 30 days and then exits everybody after they've been there 30 days regardless of where they go, whether they go back out the streets, whether they go to another shelter or another homeless program, and you're not shortening the length of stay, right? So you're actually increasing the length of stay by exiting somebody to another shelter. Your own personal length of stay at your shelter may go down, but it's not a good outcome unless a high percentage of people in those exits are exiting to permanent housing. So if the majority of your folks that are exiting permanent housing and it's in 30 days or less, that is awesome. That is exactly what you want to be doing. So you don't want to arbitrarily, again, shorten the length of stay without considering exits to housing. Next slide. So we're going to be releasing shelter metrics at the next webinar, so you can look at the kinds of things that we, and those webinars actually come with sort of directions on how you measure those things. So we wanted to just give you this so you could start thinking about this, and again, when you see the slide set, you can look at it. We're not going to go into this in depth today, but these are the kinds of things that you want to be looking at, like the stay, the populations that are using the shelter, who's not coming into your shelter. One of the things that folks often have not thought about are the long stayers. And who are those long stayers? And as we work with shelters, we've learned that, in average, most people may be leaving in a short time, but then there's, a couple of long stayers. And so who are they and why are they staying, and what focus can we get them to have so that they're exiting to permanent housing? Okay, next slide. So here we go. We're not going to talk about this in depth. This is just like this little teaser about the key elements of effective shelter. We're going to go into a much deeper dive on these in the next few webinars. Next slide. So here's your 5 key elements. So you're going to see them. They're down the middle of the screen. So number 1 is you want to have a housing first approach. It's just important that every decision you make, every policy you have is completely measured against, is this a housing first approach activity that we're doing? And the second one is safe and appropriate diversion, and we're going to talk a lot more about that, what the role the shelters play. Even if you have a robust coordinated entry system with this really working on a lot of diversion conversations, it's really important that shelters realize there's a role they play when people get to the shelter door in diversion. The third one is immediate and low barrier access to shelter. So this is not just about getting into shelter, but it's staying in shelter. Not only do we lower our barriers so that we're serving the most vulnerable people that need shelter, but we also need to make sure that our rules, our guidelines are also low barriers so that we're not exiting people for some, a lot of rules that really are not low barrier. The fourth one is housing-focused rapid exit to housing services. We wanted to make sure that even though it's not here in the slide, that it's not just, again, back to what I just talked about, the rapid exit where it's 30 days, you've hit your timeline, you're out. But this is about rapid exit to housing services. Everything that you do should be focused on permanent housing. Every conversation, everything, your environment. Does your environment look like a housing-focused organization? Are the activities that happen in the shelter housing-focused? So everything is housing-focused. And then the last but not least, and you already heard me talk about that, is data to measure performance, and not only just looking at it, and getting the report and going, great, put it in my files for next month. It's about looking for trends. What are we finding out? Staff meetings should be looking at this and talking about what are we seeing. If suddenly exits to permanent housing are decreasing or exits to homelessness are going up, what does that mean? What do we need to tweak? So it's an ongoing, it's using data to make the decisions about what you need to work on in your shelter. Next slide. So we really think about this as we often talk about it, shifting shelter, and shift happens, and this came out of as we started talking about this and looking at all the things we were learning from shelters, there were three basic themes, that there had to be this philosophical shift from, throughout the organization, from the board of directors, from the community, from all of the staff, and that philosophical shift is that this is about reframing, thinking about that shelter really is a springboard to get folks back into permanent housing very quickly, and that it is about serving the most vulnerable, that it's about screening in the most vulnerable, not screening them out. So that philosophy, that philosophical shift is just so critical. And then there's a practice shift. So in each of those core elements that we talked about, the key elements that we just talked about, is you really want to be looking at what does this mean in practice? How do we shift practice? What do we need to get our staff on board with? And then there's operational shifts that go with this, and that's all the administrative things, from what's in writing to our space configuration and the kinds of administrative operational things that we need to work on to make these shifts. So next slide. So I just wanted to share with you a little bit about how we know this works. So one example is that the Alliance works with the state of Connecticut over a period of 6 months to implement these 5 key elements, and we track the outcomes for those shelters over those months. So all of those shelters were considered to be fairly high barrier shelters. They had prerequisites such as sobriety to get in shelter, had lots of rules like, handbooks, resident, whatever you call them, resident rules, resident handbooks that were, 3, 4, 5 pages long. And over the 6 months, they worked really hard to transition to a housing-focused, low-barrier shelter model that implemented all 5 of the keys, and they saw great results. So this is from January to June of 2016, and this is data from 5 participating shelters. So here's what we found, that, so the shelters all, immediately, the first thing they did was, stopped all sobriety requirements to coming into shelter. So they increased the average, but even doing that, so in spite of doing that, so now they're serving really high barrier households compared to what they served before. And they were really concerned, excuse me, that their outcomes would go down. In fact, that didn't happen, right? So look in the slide. So they increased the average, the average number of households that were served increased from 15.8 households to 22.6 households per month. These were very small shelters. But they also decreased the average length of stay in shelter from 157 days to 108 days. And they did that by really working on, excuse me, exiting long stayers. And I'm almost done ready to turn this over, and that's good because I have a tickle in my throat. And the biggest one, Cynthia, can you do this slide?
Yeah, I sure can. Sorry, I hope you're okay. Can I get some water there? So I think we were talking about the increased exits to permanent housing by 227%. So again, these were smaller shelters, but they were in different areas, and areas that sometimes are very high cost, sometimes with not a lot of housing available, and just in the course of 6 months were able to over double the amount of people they housed in the previous 6 months. And they're also, again, as Kay said, serving more people, decreasing the average length of stay. And so we're sort of using this model in several other places right now, and we're learning from it and seeing that that these impacts are working in a lot of different places. So this is exciting for us to see and learn. And the great thing is that we have these shelters to talk to. So in a later, I think it's the third webinar, we'll be hearing from these shelters about what it really took to change so drastically in such a short period of time. They had no new extra resources. They have tight housing markets, and yet they were sort of able to get some great outcomes. So we'll be really excited to hear from them. And I think
thank you for doing that. I think my voice is back, but thank you so much for taking over. Thanks.
Very welcome.
Okay, so it looks like it's time for our next poll. So we want to just check in and see how you guys are feeling about implementing the shelter model. So we want to know, are you excited, anxious, or annoyed, exhausted, terrified, confused? We know that you may not agree with everything that we're saying, and so we want to just acknowledge that this is definitely a shift for a lot of you. So we just want to know, check in with everyone and see how you're feeling. Wow, many more votes than the last one.
I know. You can be honest. It's anonymous.
Yeah, this is anonymous. We're not going to ding you if you say the wrong thing. There's no wrong answer. So, okay, 60%. I need a couple more of you to vote so we can see how you all are feeling. 65% have voted. Okay, I'm just going to wait for it to get to 70, and then I'll close the poll. So if you haven't voted, put your vote in now. Come on, a couple more people. Okay, there we go. We're at 70. So I'm very excited to show you this poll because 69% of you are excited about implementing this new shelter model, which is great. We're a little anxious, exhausted, and confused as well. Just a few of you are terrified. That's totally okay. Thank you, everyone, for filling out the poll.
Thanks, Hannah. I'm really amazed that so many people are excited, and I should have also probably thrown overwhelmed in there. And I appreciate the honesty from the folks who said they were less than excited. And I hope that, as Anna said, and we were going to say many times, it is totally normal to feel nervous about all of this stuff. And I'm glad that so many of you are excited. So we are going to talk a little bit about what is next. So what we have coming up in future webinars and some of the tools we'll be releasing are kind of looking at some of these things and more, but these are some of the main topics. We'll be talking about what does low barrier shelter really look like? What does it mean? Does it mean you have no rules? Does it mean it's a free-for-all? What does low barrier shelter really look like? We know that people have a lot of different definitions of that. How do we maintain safety in a low barrier housing environment, a shelter environment? What are housing-focused services? What does that mean? Do we have those? How do we get those? Which rules are the right rules? How do we, have expectations for people if we're going to have a low-barrier environment? And I know a lot of people have sometimes client handbooks or lots of policies and procedures. Really encourage you to look at your policies and procedures as we go through this process, and we'll tell you next month probably to actually bring your rules with you to the next webinar. How do we use data to track progress? How do we implement the equal access rule, which is a HUD regulation, and we'll have a whole webinar on that, and it's a very important rule. How do we determine what shelter capacity we need? I know that that is a question in just about every community, so we'll touch on that as well. Now, I know a lot of you might be having some concerns about this new shelter model, or at least some questions. These are questions that we have gotten a lot of in working in the communities that we've been talking to for the last couple of years. And we want to make sure that you know that we are going to work through these questions with you. We don't have perfect answers for all of them, but we will respond to them. I think these probably match some of the questions that have been coming in. So I will just quickly mention them in case you're one of those people that might have one of these questions. What if our clients aren't ready, quote unquote, for housing? What if we are, quote, setting people up to fail by putting them into housing too quickly? What if there is just not enough housing available in our community? I'm sure most of you feel that way. What if we don't have extra resources for these changes? And what if staff quit, staff that maybe aren't on board with this new model? And what if we are destabilizing people who are trying to stay clean and sober in a shelter with people who are using? So we will come back to those questions. Stay tuned. I know we're trying to really tease you and make sure you come back, but we hope that those are some of your common questions. If you have more questions, please put them into the box. We won't have a lot of time to answer just because we have so many people, but we will certainly try to answer a couple at the end of this, and also we will post frequently asked questions in some time. So one of the things I want to post to all of you on the webinar is, all 600 million of you on the webinar, is what goals will you set for your shelter over the next 3 months? And I think breaking things down into sort of chunks is helpful, because it's sort of overwhelming to think, you know, what am I going to do the next year or 2 years? But what will you do in the next 3 months? What will you do in the next month before the next webinar? We have some tools for you to sort of help you think through that. And I believe that you can download those. Yes, you can download some of those tools from the, again, as I said, from the handout section of the webinar, and I'm also going to show you a link. And I believe we have another poll here. Is that right, Anna? Yes, we have a poll on what you might be interested in learning.
So this is your chance to tell us what you want to hear about during future webinars in this series. And I know I've been monitoring the poll questions, and a couple of you guys have been asking for more information about Housing First, for diversion. So this is your chance to give us that feedback. What do you want to know more about during this webinar series? Housing First, diversion, low barrier shelter examples / retooling your rules, housing focused rapid exit services, and measuring outcomes. I see about 48% of you have voted, so we really want to hear from you. This is going to help inform the rest of the shelter series. So please just take a minute to complete this poll so we can get that feedback from you guys. A little under 70% have voted, so I'm going to keep it open for just one more minute. Okay, so let's see what the results are here. It seems like we are pretty close neck and neck between wanting to know more about low barrier shelter examples and retooling the rules, and how housing-focused rapid exit services work. There's some interest in diversion and measuring outcomes as well.
Great. So we will definitely take a look at that, and it'll help us inform kind of what we should be focusing on. So that's really helpful. And again, if you want to put things into the question box, we will look at those. I know we won't have time for those today, but we will definitely look at them and try to respond to them as best we can. So for next steps, as I said, we really want this to be, you know, really action-oriented over the next few months. We want you to feel like you have a path forward. And so we want you to complete the shelter self-assessments that we have, and you can find them online here, and we can also, we'll put that in the chat box. That is an online survey where you can sort of do the self-assessment questions and kind of get a sense for where you are, and that'll help sort of let you know kind of where you need to go. It will give you a score, and it'll sort of, it'll take no more than 15 minutes, I would say. They're pretty quick questions. But you can also do the self-assessments and action plan with your whole team or your staff. You can download those same self-assessments from the webinar resources or find them on our website. We have this website as a page that will be a hub for all of the resources and tools we talk about over the course of the series. So you're going to want to check back there pretty often. So again, please finish those self-assessments. They kind of correspond with the different keys to effective shelter. It'll sort of really help prepare you and probably get some good conversations going at the staff level in your programs. So we hope that that is something that you can get to. If you don't do them before the next webinar, we won't We won't penalize you. We'll be sad, but we really do hope you get to them because we think they're going to be really helpful. So what's next? We want you to register for the next webinar. The next webinar, as we've teased you many times, is the Keys to Effective Low Barrier Emergency Shelters, and it's on May 17th, 2017. You're going to get an email after this webinar that will give you a link to register, or you can register on our website. I'm looking at the time, and I'm seeing that we probably don't have a ton of time for questions. I know we're already a couple of minutes over. So I apologize for that, but I will take a look. We will definitely take a look at all the questions. I know there's a lot of them that are similar, or in kind of we can group them together, and we will respond with in our next webinar to the questions, and eventually post frequently asked questions. So we appreciate your questions. They're not going to get lost. I promise we're going to take a look at them, and they're really helpful to us to inform kind of what you're looking to know. If you want to contact us, please email the center@neh.org, and your email or question or whatever you would like to know about we'll respond to as soon as we can. We really are just looking for feedback, so please don't hesitate to reach out to us. And we really thank you. We thank you for being with us for this webinar, and hopefully for the rest of the series. We're really excited, and we hope that you found this useful, and we will be talking to you soon. Thanks, everybody.